It seems that everyone wants a perfect pout. Well, my next guest says the secret to perfect lips is all about the chin. Please welcome Dr. Kevin.
Thank you. It's lovely to be here.
Dr. Batra and I are excited for this discussion. So people talk wanting to have these gorgeous, pouty Bridget Bardot lips, right? They think they want their lips bigger, but is it really all about balance, facial symmetry, and looking at the face as a whole?
Well, I think you nailed it on the head there. Clients often come in, they want big lips, and the question is, will it look good on their face? And it doesn't matter if the lips are bigger or smaller. What is the most important is the overall proportions. When you look at somebody, you don't really pay attention to the size of their lips. If everything is proportionate, they'll look great. And one of the important segments of the face we want to look at for the lower third is the position of the chin. There's no point having a teeny tiny recessed chin and great big lips. You want to balance the chin to support the lips, and then you can grow them to the appropriate size.
So Dr. Kevin, tell us what you're going to walk us through today. Tell us about this procedure.
So what we plan to do today is to do volume augmentation of the chin to provide that balance, and then augmentation of the lips themselves to provide a little bit of voluptuous pout. Nothing too crazy, but just to give some hydrated volume and shape. We're going to use a combination of needles and blunt cannulas to do it in a safe method. And then we'll use a filler that's a reversible hyaluronic acid gel to provide these types of results. We're a very safety conscious type of clinic, and we like to have an out. So if there's a problem at all, these are reversible products. Either the client isn't happy with the results or there's a lump or a bump. At least you have a way to reverse these results. The downside is if you love the results, it requires a little bit of maintenance. The good news is if ever there's a problem, you have a way to reverse it.
So tell us about your patient, doctor.
All right, so this is our lovely patient, Juvia. If you want to take your mask off, we can have a little look. So when we have a client come in, the first thing I want to do is look at the surrounding area of the lips. So that would include everything from the bottom of the nose to the bottom of the chin. And this is a case where we say there's a little bit of recession in the chin. And if we can augment that with a little bit of forward projection, it will really enhance the natural jawline as well as supporting the volume that we want to put into the lips. So we use an anesthetic, a very teeny tiny needle. We'll inject it underneath the lips. Everything goes nice and numb. We want this to be a comfortable procedure for the client and to make sure that we can do it in the safest manner possible, which involves them being relaxed and not having any significant pain.
Let's get going.
All right, off we go. And the first thing we'll do is we'll get started with our dental block. And then after we've done that, we will use a antiseptic to cleanse the skin, and we'll put a few markings on the areas of concern. I'll give you a little distraction device there.
So the distraction device, Dr. Kevin, looks like a gold wand. And actually, that's a nice tool because it's a little vibrating wand that the patient can apply or the practitioner can apply. And it just distracts them while you're actually sticking them with the actual needle of the injection. So that's
Exactly.
for viewers, they can understand what's going on with you there right now.
Lots of teeny little tricks to make this as easy as possible. So if you can lift your chin for me, I'm going to have you open slightly. I'm going to start on the bottom left, and you'll feel a little pinch and then some pressure. So 3, 2, 1, scratch. Doing okay with that?
Mm-hmm. And one other thing, aside from patient comfort, that it's probably worth mentioning while someone's numbing, is that I find, and I'm sure Dr. Kevin and Dr. Orden agree, is that if they're really comfortable, that keeps their blood pressure nice and low during the injections, which makes them a little less likely to bleed or bruise from the needle sticks themselves.
That's right. And this anesthetic will kick in quickly and will last for about 1 hour. You can open again for me. I'll start on the left here.
Well, Dr. Kevin, we got you started here, and you're getting your patient comfortable. We get what you're going to do. You're going to inject the lips and the chin as well on your patient, Juvia. So get started, and we will check back with you later in the show to see those results. How's that sound?
Perfect. We'll see you then.